Hi, I would like to welcome everybody to our meeting of the Compliance and Consumer Confidence Working Group. My name is Evelyn Cardenas. I'm with the Central Florida Auto Dealers Association, and along with Pastor Roderick Zach from Joyce and Lord Ministries, we co-chair this working group. As we head into our meeting, I did want to take a moment to say thank you to everybody on this call for being here, for everything that you do. We cannot do it without you. We're in a tough situation. And so we appreciate all the input, all the help that you can give us as we go into the hard task of building consumer confidence and trying to get some compliance in this process. Not an easy task, but that is why you guys are here. So thank you for all that you do. And with that, Pastor Zach, you want to take the roll call?
Yes, thank you, Dr. Cardenas. And again, let me reiterate your appreciation by this hard work. So I'm ready. If you could mute your phone lines and unmute to stay present. So the first is Alan Johnson, City of Orlando and Orlando venues. Alan Johnson. Okay. Augusto Sanbrina, Prospera.
Present.
Okay. Becca Bediz, Visit Orlando.
Present.
Brad Gilmore, SeaWorld Parks and Entertainment.
I'm present, thank you.
Great. Chris Earl, United Safety Council. Chris Earl. Chuck Whitall, Unicorp National Development.
I am here.
Conrad Santiago, the Tritum Santiago Group. Conrad Santiago. Okay. Dana Elisa Green, Full Sail University.
Present.
Thank you. Dan Giordando with Rose and Shingle Creek.
Good afternoon, Pastor. Present.
Thank you. Dan Ward, Curley and Penn, the strategic firm.
Present.
Thank you. Florencio Larry Rodriguez, Don Julio's Mexican Kitchen.
Present.
Thank you. Frank Gokel, Wyndham Destinations.
Present.
Fred Kittinger, UCF.
Good afternoon, present.
George Rawls, Orlando Health. George Rawls. Harold Mills, VMD Ventures. Harold Mills. Thank you. Thank you. Inez Long, Black Business Investment Fund, Florida. Inez Long. Jay Gilbreth, Valencia College. Jesse Martinez, Alphon N.
Present.
Jesse Martinez.
Present.
Okay. Jessica Henlon, staff at Full Sail University.
I'm present.
Okay. John Madison, Orange County Farm Bureau. John Madison. Julian Maynard, FAMU.
Present.
Wonderful. Kerry Burns, Florida Restaurant and Lodging Association.
Didn't you just hit her through?
Could you mute your sound for us? Thank you. Again, did we say Kerry Burns? I mean, did he answer? Oh yeah, I see. Thank you. She's present. Lorene Martinez, Orlando Economic Partnership. Lorene Martinez. Manny Rodriguez, Rollins College.
I am present.
Wonderful. John Michael Thomas with John Michael Exquisite Weddings and Catering.
I am present.
Monisha Brown, Walmart.
Good afternoon. I'm present.
Thank you. Nadine Tarpley, Also Jazzy Hair Salon. I see you, Nadine. Okay. Phil Brown, Orlando International Airport.
Present.
Thank you.
Pastor.
Thank
Thank you.
Paul Pino, Raul Pino with the Florida Health Department in Orange County.
I'm here, sir.
Thank you. Reginald Green, FAMU College of Law.
Present, Pastor Zach.
Thank you. Rich Costellos of University of Orlando. Rich Costellos. All right.
Present.
Thank you. Robert Ensuelo with the Orange County Sheriff's Office.
I'm present. Good afternoon.
Thank you. Sabrina LaRosa of UCF.
Good afternoon, everyone. I'm present.
Okay. Esther Percival of Valencia College.
Good afternoon. I'm present.
Wonderful. Steve Jameson, the Mall at Millennia.
Good afternoon, Pastor. I'm present.
Thank you. Sam Stark of Rollins College.
Hello, I am present.
Tricia Johnson of Seminole County Government. Tricia Johnson. Dr. Vincent Sue of Advent Health.
Present.
Wayne Rich of Nelson Mullins Broad and Castle. Wayne Rich. I see him. I see him. He's present. So are there any names that weren't on my list to call today? If you would make yourself known, we greatly appreciate it.
Yeah, Pastor Zach, we need to acknowledge Stephanie Howell. She
Okay.
was the representative for Valencia College, and Jake Galbraith. That was a mistake on my end. I need to take him off the official roster. Stephanie will be the other representative for Valencia.
Okay, so I'll pass it back over to my colleague, Dr. Cardenas.
Thank you, Pastor Zach. And so now we're going into the public comment portion of the meeting. Usually the public has up to 5 p.m. the day prior to submit their public comments, and they're given about 3 minutes for a public comment. Do we have any public comments, Lucas?
No, ma'am, we have no public comments for this specific working group today. Thank you.
Okay, so then back to you, Pastor Zach, for approval of the minutes.
Thank you. So we'd like to receive a motion for approval of the minutes. A motion and a second.
Phil Brown, move approval of the minutes.
Okay.
Sam
Ward, I'll second.
Okay, it's been moved and properly second. All those in favor, would you please indicate by opening up on your mics and say, hey, hey.
Aye.
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 All right.
Thank you. All right, so we have health updates next. Dr. Evelyn.
Okay, we are glad to have again with us Dr. Raul Pino from the Florida Department of Health in Orange County. He's joining us today, and along with Dr. Vincent Hsu from Advent Health, they were going to give us a COVID update. So as a group discussed yesterday, we would like our medical experts to weigh in on setting a goal for the county as we continue to reopen. So until we have a vaccine, we will not be able to achieve maybe the 0% that we discussed yesterday, but we can pursue a similar goal and kind of explore what that looks like in terms of positive cases and maintaining masking and social distancing. So Dr. Raul, I'm going to hand it off to you.
Good afternoon. I will allow Dr. Vincent Hsu to go first, as I know he is tied up with time. So Dr. Hsu, if you want to go first, that is fine, with the permission of chairs and co-chair.
Sure, thank you. We had discussed the trend yesterday, and today really the trends in our inpatient census really is the same. It's an upward trajectory. Today, we have additional cases compared to yesterday, and we're currently at an all-time high, just over 3 times the peak that we had in late March, early April. Right now, the focus is on ensuring that we have the staff necessary to take care of these large numbers of patients, that we've got the bed capacity. Everything so far indicates that we are still able to do so and take care of these patients in a safe manner. The concern that we have, of course, has to do with the increasing numbers that occur in the community. And there's always a lag time that is associated with hospitalizations and positive cases. So because the cases continue to, even though the cases for the last couple of days, as Dr. Pino will tell you, haven't been quite as high as they were over the weekend, the lag time would indicate that we should be expecting to see still significant numbers of increased cases. I wish that there were more that I could say in terms of a therapy, in terms of getting these patients, treated quickly. The good news is that they, as mentioned yesterday, they tend to be a little bit younger, and so that doesn't cause as much in the way of ICU or ventilator needs. But again, if you get enough patients, even if they're younger, that will end up filling our beds as well. I just want to continue to stress the need that the best way to prevent hospitalizations, best way to prevent COVID, of course, is to follow the public health guidance for universal mask wearing, for social whenever possible. Those steps really do impact the hospitals in a very big way. So with that, I will go ahead and stop and turn over to Dr. Pino or take questions if there are any.
I have a question, Dr. Shu. When patients are being admitted currently and they're not needing that intensive care, what is the average length of time that people may be staying in the hospital?
If they don't require intensive care, it will be significantly shorter. The main reason that they are in the in the hospital is really to receive oxygen therapy and or perhaps fluids that may be needed for dehydration and so forth. The average, if you're in the ICU and require a breathing machine, you will be likely in the hospital for an average of at least 2 weeks or even longer than that. If you don't require intensive care, that is really a lot shorter. And we're right now, our data suggests that we're talking about 6-7 days, a lot shorter, which means the turnover is greater. So it's really all a matter of supply and demand. If there are more patients admitted than we discharge, then the census continues to go up. So we're just hoping that that balance will eventually be in the favor where we can discharge more than are being admitted.
Any other questions for Dr. Shu? Okay, Dr. Raul Pino.
Yes. So good afternoon. Piggybacking on what Dr. Shu was saying, yes, there has been an increase in hospitalization. I'm going to share with you today's data. It's coming. So you should be seeing it right now. So here in the middle, listen, we have 10,000 cases, and this is kind of Palm Beach numbers. We would never dream that we would get to 10,000 cases when we were a couple of weeks ago, 3-4 weeks ago in 2,000, less than 2,000 actually. So we kind of climb it fast, but as you can see, the last 3 days, the 28th, the 29th, and the 30th, we have seen a deceleration of what was happening before. So we are cautiously optimistic about this little trend. But as doctors say, hospitalizations lag behind a little bit. So next week, if things continue to follow this projection, next week we should see a peak in hospitalizations in our county. Also here, I want to show you there has been a decrease lately, but just one day, so it doesn't mean any trends in the number of ER visits for shortness of breath and coughing. So that's something to observe. And here are the hospitalizations that we have seen. I'm going to share with you other data on hospitalizations so that you can better see what the trends are. This one is that, please don't take any pictures of these images. Let me see if I can pull it. What is it? I have to bring it up. It is. Let me see.
Just a reminder, Dr. Pino, that this is a sunshine meeting and it's being carried live. So be mindful of the data that you share.
Yeah, the data can be shared. What it cannot be is, yes, we can share. So the number of available beds is 435, and the number of ventilators that we have available today are 519. We also have 57 ICU beds available, 12 isolation beds, 413 acute beds, and 27 pediatrics beds. As you can see, we continue to have what can be considered healthy inventory, and this could increase if needed by canceling elective procedures. That can be also done if needed to increase the number of beds. But right now, although we have higher numbers than ever, we don't see that the system has been overwhelmed in any way. Data also here, I'm going to share with you hospitalizations and other trends. As said last night at 5 o'clock, we had, let me see when it comes to you. It's doing it. But last night at 5 o'clock, we have 324 individuals hospitalized. That's an increase of about, 34 individuals from the day before. But also on ICU, we saw an increase of only 4 individuals. So that goes with what Dr. Shu was saying, that the number of hospitalizations has increased, but these individuals are not requiring as much ICU care, at least as now, as the prior wave that we saw in late March, early April. So that's the information that I have for you. If anyone has any other question, we have plenty of data that we can share with you if you have some specific questions. Thank you.
Dr. Pino, this is Robert Answader with the Orange County Sheriff's Office. I just have a question on the hospitalizations. Is the ER staff, are they doing contact tracing? Are you seeing any type of situation where people are coming in? Are they associating the bars? Are they out at the beach? Are they part of large gatherings? I mean, is there any kind of...
Yeah, we have seen the last 2 weeks, we have seen younger individuals, and we have interviewed on the phone many of them, thousands at this point, and they all are expressing basically the same. We were out in a group of friends, and someone was positive, and then we all got it. And that's how it went. And it has been gatherings mostly indoors that are the points that we can point at it. That doesn't mean that it's not happening the community distribution widely distributed across our community, but the events that where we can point more people acquiring the virus at the same time in the same location, those are normally indoor facilities that we can point at.
Thank you.
And Dr. Pino, of course, I have a question.
Yes.
2 things. One is, I was on the website earlier, it appears the death rate has gone way down. And secondly, there was something reported nationally, and I'm curious the accuracy of this, is that when we're reporting the positivity of COVID cases, they're including antibody tests. So let's say 10 people test today, Wednesday, positive for COVID, and 5 people test positive for antibodies. They're considering that 15 COVID tests. Is that accurate?
No, for Florida. I don't know the cases. Florida, what Florida is including is antigen test. That's what Florida is including in the count now.
But is that going to show people who previously had it reflect on the curve as if there's more than actually tested positive with COVID, people who are exiting the disease versus entering?
No, because people who have immunity, people who have the antibody test, and have developed immunity for the disease. So it's complicated. There are 2 types of immunity: acute immunity and long-term immunity. So those people who develop immunity, depending on the type of immunity they have developed, you can establish that they already had the disease and they are not in any infectious period. That's different than the PCR and the antigen test, and those are different because then they are considered to be infectious. The count will reflect that starting, I believe, today. We haven't received guidance how that's going to be reflected on the pages, but they will count for the number of cases.
So therefore, will that, when you start counting that, is that going to show an uptick by counting those? And then if you could also answer the death rate question.
Yes, it will show an uptake as it's a new methodology to diagnose, but it will be with any new methodology that may come. In some cases, people are receiving both tests, but only one will count. So that's to prevent any double counting in those cases. But we will see an increase. We will see, but it's not a significant increase in the sense that it will be the same if we continue to expand PCR testing. It's just that it's another test, it's rapid test. That's an advantage. The disadvantage that Litter has is that you can have some false negative. But we will be looking also to acquire some machines for us and the county to start including that test in our portfolio. We are working on that process right now.
Okay, Dr. Pino, the last part was, is the death rate going down? It does appear that the percentages are significantly down. I assume that's because the younger group is tested positive, therefore bringing the death rate overall percentage down.
It has been accelerated. A couple of weeks ago, we got a few cases, one after another one, meaning a few deaths. Right now, it seems to be more sporadic. Our rate is lower than the state. I will have those numbers for the press conference, although I have it. If you need it, I can dig it out in some email. But they're getting ready. But our death rate is lower. It's also lowered the age for us of the average age of the people who are dying. We went down 1.5 year in that in the median age, and that's an indication also of what you just mentioned, that the pandemic is a little bit younger in our county.
Thank you. That's all I had.
Hi there, this is Monicia Brown with Walmart. I have a question for either or both of the doctors. There seems to be an anticipation that with the holiday, there's going to be a lot of activity, people are gathering. I'm just curious from the medical professionals, what are you anticipating over the next week based on what you're hearing and what you know, and what should we be prepared for?
Well, in our case, we are concerned and hopeful at the same time. Concerned because Memorial Day show us what it can do to this pandemic if we go unruly on holidays and gatherings. hopeful because I've seen a decline, a small decline in the last few days. And also, I have observed an increase of mask wearing around the county. And that gives me hope that perhaps we have learned our lesson. The community before was just absolutely wonderful. We brought percentage to 2.9, and that was thanks to the work of the community. We just had a full sense of security and probably were victim of our own success with regard to the pandemic, and we relaxed it, and people relaxed it too much.
Dr. Pino, you were asked a couple of minutes ago about contact tracing. I'm curious, with the cases that you've seen of these younger individuals, have you been able to do any tracing at this point to show that that has now started to have an impact on family members as well? Have we been able to show that it's spreading from those younger individuals to their family members? Have there been any health impacts from that?
It's yes to all those questions. We have been able to establish some transmission in multi-generational housing, where older individuals are getting infected. And actually, and this is off the top of my head, but in the last 2 weeks, probably 30, 40%, maybe even 50% of the people who have died, we knew that was exposed to someone very close who was positive. In that sense, we know the exposure, we know the individual, we know what happened. So it's very clearly established that where the transmission was in those cases. And in many cases, it's a younger individual who passed it on to an older family member.
Thank you. I know that Becca Beatus is on the call. I think that kind of speaks maybe, Becca, to some of the messaging, especially working with the colleges and some of the younger folks in terms of the impact that we're now seeing from those cases.
Yeah, we have tried to continuously mention these during the press conference, the need to protect individuals. The first part of your question was about tracing. With these large numbers, although we got additional employees and they are getting ready to roll, they assign us 39 contractors to increase tracing in our community. The county is also looking to support some additional positions to increase that work. But I think that we should, I'm advocating with the state to not to go crazy on tracing and not to try to trace everyone, but to concentrate in those tracing that are most significant so that we can do a really good work in some areas. For example, outbreaks are critical. When we see more than 2 individuals clustered in a location or a space or type of activity, it's important to tackle those fast. Also, those activities that are essential to the economy and to the function of society, like healthcare workers, first responders, and also people who are vulnerable, and that's the homeless population, and also people who are in long-term care facility. I think that those are areas where we should retrieve and protect even more than we are doing right now, because those where we are going to have the poor health outcomes. Going and trying to chase one individual in one neighborhood that we have a hard time finding for some reason, I consider myself that we need to move to the next person and try to prevent this. Also, the lab delays, the lab result delays is not helping in the process because individuals get the results 5 days later. And if they were 3 or 4 days after the infection that they decided to go and get tested, we're already in day 8 or 10 when we get to them. Transmission already happened. And so it's important in these cases to have quick lab results. It's not how much lab tests we do, it's how quick we get the results that we get so that we can act earlier than transmission. And that combination of all those factors is what has contributed to what we are today. It's not just one thing, it's a multiplicity of things.
Dr. Pino, this is Kelly Teague, staff at Orange County. As this working group focuses on compliance strategies, is there a goal, a percent positive that would be a best indicator for us as we look towards what we want to see in the community?
So the state has set up, there are goals in the different plans by the nation and the state, and they take in consideration the last 14 days and how sustainable that change it is. The state has set up a goal in the dashboard of 10% positivity rate in the last 14 days. We are at 7.9 average on the entire duration of the pandemic. And we are above 15.4 for yesterday. And if I recall the data correctly, 15 something also the average in the last 14 days. So that's where we are. But 10, even 10 that the state set up, I think that 10 is higher, but that's where they set up the benchmark. I think Orange County, we should go back to 2%, 4%. Where we were before. That's very manageable. Because the issue with this disease is also the speed at which transmit, the number of people that avalanche into the healthcare, and then overwhelm the healthcare, the ability to provide services for those who really, really need it. And that's when you get into trouble, when you have to rationalize healthcare.
Dr. Pino, is there a burnout rate? I mean, we all keep talking about the vaccine in December, January, February, whenever we're lucky enough to get it. But is there a burnout rate that the increases of positivity start to, I guess that'd be the herd immunity or whatever, but eventually when we're getting over the hump of this without the vaccine?
Well, positive herd immunity has to be about 60%. And that will be very difficult to acquire without a vaccine. And even they are saying that some of the vaccines may not give us that level right away. So that's what is considered herd immunity. Anything above 60%, you increase protection for the community at large.
Have you looked at the analytics of when we would achieve that? Is it?
No, not without vaccines. We will not achieve that without vaccines. It will take, and I'm not predicting anything, but if this disease were to be a cycle every year, it will take a few years to get to 60%.
And Moderna talks a lot that they think they may be able to administer this vaccine as early as December. What are your thoughts on that? And what research have you looked at on that?
So my understanding is that there are several vaccine candidates, and there are some renewed optimism that it's going to be ready by the beginning of the year. It's a new technology in developing vaccines that speed up the process. So it will have an impact not only for COVID-19, but for the future, how quickly vaccines can develop. And, with a vaccine, the most important thing is what level of immunity that vaccine is given to the community at large. That's the critical answer. Then that's a critical question that needs to be answered.
Any other questions for Dr. Pino? Okay, Dr. Pino, thank you for spending all this time with us and giving us all that information. It's a lot to process. Still many unknowns, but thank you for that. I'm going to hand it back to Pastor Zach. He's going to get us started on compliance.
Okay, thank you. Prior to our discussion on compliance strategies, we want to ask Dalen Schott, who's the assistant county attorney, to come back today. We asked him to come back today and answer questions that were raised yesterday regarding what can the county do when it comes to compliance and what other counties in Florida are doing.
Good afternoon. Thank you, Pastor Zach. I'm Dylan Schott, Assistant County Attorney with the Orange County Attorney's Office. We got a lot of questions yesterday in regards to enforcement of the face mask order and what the county could do possibly moving forward, what recommendations the working group could make to the mayor. So I'll talk a little bit about that. Let's go to slide 9. Just pull up the slide here. Okay. So as we kind of talked about yesterday, the Face Mask Order 2020-25 doesn't include an enforcement provision, and that was by design, right? The mayor had said in his press conferences that he wanted to take a measured approach. He didn't want to jump the gun and start enforcing this or putting this burden on law enforcement to make arrests or issue notices to appear right away. He wanted to give the community sort of a chance to prove itself and comply voluntarily. That said, it is a mandatory order, and everyone is still required to wear a face mask. The mayor has mentioned that if the voluntary compliance doesn't work out, and we continue to see an uptick in cases, that we'll have to reassess. And so that was what a lot of the questions were about yesterday is, well, what does that reassessment look like, and what other routes could the mayor potentially take, or could the working group recommend to the mayor? Those would look like, generally with these emergency orders, there's a penalties provision that's included in Chapter 252 Florida statutes by the Florida legislature, and also in our Orange County Code. And that is a fine up to $500 or imprisonment in the county jail up to 60 days, or both. And those are sort of the penalties for second-degree misdemeanors. So that is generally criminal violations. And in the past, when we've enforced emergency executive orders, for example, the curfew order that we had in place, I know the Orange County Sheriff's Office issued a few notice to appears in that case, and basically if the Sheriff's Office found someone in violation of the curfew, they'd issue a notice to appear. The person would then go to court, and it would be resolved then, whether they pay a fine, how much is the fine, whether they would have to do any days in jail, and that kind of thing. So I wanted to talk about what other counties are doing, just to give the working group an idea of what kind of recommendations it could make. I think it helps to have sort of concrete provisions that are in place in other jurisdictions in Florida, just to give everyone an idea of what could be possible, what recommendations it could make. So in Osceola County, their order doesn't have an enforcement provision, just like Orange County's. And they had one to begin with. They got some pushback from the community, and they removed it. I included that just as an example to show that, hey, Orange County is not the only county. In fact, the county just to the south of us doesn't have an enforcement provision in theirs either. So it's not unusual to see these face mask orders not contain an enforcement provision. The next one I want to talk about is Seminole County, and their enforcement provision is pretty explicit that it is that the order is intended as a measure to seek voluntary compliance, and that the order is intended to educate the community and warn the community of the dangers of noncompliance. They say that right in their order. So it's that part is similar to Orange County's, and that was the intent behind Orange County's as well. That said, Seminole County went a step further than the Orange County order, in that it said, in the event that they don't achieve voluntary compliance, then their order could be enforced under Chapter 252 and by any municipal, county law enforcement or code enforcement officials. And again, that Chapter 252 is from the Florida legislature, and it is those penalties we discussed on the previous slide, up to $500 fine, up to 60 days in jail, or both. The third order I wanted to talk about was Alachua counties. And Alachua counties they were very explicit. They did not want their face mask, violations to be considered criminal. So that would be a bit of a distinguishment from Seminole County's order. So theirs is a non-criminal infraction. They spelled out in their order, violating this face mask requirement doesn't authorize a search or arrest of any individual before they're given a chance to comply. So the enforcement official has to give them a chance to comply, and they have to be given a chance to explain how the face mask requirement doesn't apply to them. If you recall yesterday, I went through Orange County's face mask order, and I went through a lot of the exceptions. For example, if you have a health condition that prevents you from wearing a face mask, you're accepted. If you're a child, you're accepted. So Alachua County sort of spelled out in their order that people have to be given a chance to comply. They have to be given a chance to explain why the order doesn't apply to them before any enforcement actions are taken. Alachua County relies on their code enforcement officials to enforce that provision of their order, the face mask provision. It's a bit of a gray area as to whether Orange County can do that. Our county code is different from Alachua County's code, and you'll see next, Broward County's code. It's different from theirs as well. So whether Orange County could do that, it's a gray area, but it's something we could look into if the working group decides to make that recommendation to use code enforcement officials as opposed to law enforcement officials. So Alachua County, their code enforcement is sort of ordered in their face mask regulation to issue a citation, $125 citation for the first violation. Then they're ordered to up it to $250 for the second violation, and then they can issue up to $500 for the third or any subsequent violation. And those limits are sort of spelled out in Chapter 162, which deals with code enforcement boards of counties in Florida. And then the last order I wanted to talk about is Broward County's order. Broward County's order authorizes both law enforcement and code enforcement to enforce their face mask order. So that's a little bit different than what Alachua did, where Alachua, as far as I could tell, really was leaning on code enforcement to do it. That's not to say law enforcement can't do it in Alachua County, but the intent, I think, and the purpose behind their order was for code enforcement to enforce it first and foremost. So Broward says law enforcement and code enforcement, and theirs could be a civil penalty or a criminal penalty. So if it's a civil penalty, you're looking at a $1,000 fine for every day that you're in violation. And then if it's a criminal penalty, it goes back to those same penalties we discussed earlier, up to $500 fine and up to 60 days in the county jail. And again, on that issue of whether code enforcement could do that here in Orange County, what Broward County actually did, like I mentioned, it's a gray area. So what they actually did was they amended their county code and spelled out in their county code, we are authorizing code enforcement to enforce emergency orders, and they shall be enforced, in this manner, in the form of fines and citations and that kind of thing. So that may be something, if the working group decides to recommend code enforcement and enforce something like that, and if the mayor decides to go that route, that may be a hurdle for Orange County to do if we determine that that's necessary. That being, we would have to amend our code to actually spell out and authorize code enforcement to enforce a face mask or other emergency order. So that about concludes everything I had to present in regards to the enforcement and recommendations that the working group could make.
Attorney Schott, question. I guess I thought in our initial conversations we were talking about what is the enforcement policy with businesses in terms of they're not complying with various aspects of the task force recommendations. So was that part of what you considered too?
So so it's my understanding the way the process works is the working group would make a recommendation to the mayor, and then
To the larger task force.
to the larger task force, and then the larger task force makes the recommendation to the mayor, and then the mayor decides whether to pursue or implement that policy. And so at that point, if the policy is implemented, then that's when we would get into enforcement and penalties and what those look like. And generally, the policies are generally implemented through emergency executive orders by the mayor, and penalties look like up to $500 fine, 60 days in jail, or both.
I guess let me clarify my question again. The question is regarding to businesses, not individuals relative to face masks, but businesses that aren't complying with the task force recommendations. Is there something in place currently? Roseanne, do you understand what I'm referring to?
Yes. Can you hear me? Can you hear me, Pastor Zach? So you're asking those 7 guidelines that we passed at the beginning, the guidelines for reopening business. Those were recommendations. We did not have enforcement behind that. But we do have those recommendations. One thing that came up was that some other counties are doing is sending just a notice to these businesses reinforcing those guidelines. So again, it's not enforcing it, it's just reminding them here are the guidelines. And we've also brought up, do you ask them to take some kind of pledge or promise? So there's the carrot or the stick, kind of whichever way you do. But right now we've been trying to use the carrot and encourage people to comply.
The state and the DBPR is doing something at their level.
Yes, and the DBPR holds their professional licenses, so they can come in and do enforcement. And what you saw with the bars, and I can just tell you from the emails that we got, we had a lot of people starting to complain, and they were really overwhelming DBPR with all the complaints about bars. So they were sending somebody out to do a site inspection and to verify these complaints. And then if they had and then they were also, I think, Dr. Pino, I don't know if he's still on the call, using some contact tracing too. So if you, like one bar in particular, if you end up with 30, 40 people who test positive and you've gotten complaints and you've had somebody from DPPR go out and verify that they're above capacity, then they went in and they were pulling liquor licenses, which they can do. And then they got so overwhelmed with complaints that they just shut down bars until they could get everything, I think, calmed down. They did, they're clarifying some of their executive order today, I believe.
Roseanne, do we know, aside from the bars, they shut those down, we know what happened there. Have we had compliance issues with many other businesses? I mean, if the bars were the main culprit and it's been resolved by them being shut down temporarily right now, instead of having code enforcement, changing the Orange County code, which as you know and I know takes a couple of months to do, code enforcement officers could go around and just, like you said, whether it's a mailed notice or they give them a notice that they need to comply without violating them, since they don't have the right to violate them without the code being changed. Are we having a problem with restaurants in general? I am not seeing it with restaurants. I went to lunch today, there was 2 tables in the restaurant. I'm seeing the opposite. Restaurants are closing all over because they can't get enough business to come in them right now. So I just want to know what we're targeting. Where is the issue? Do we know where it actually is at this point?
That's a good question. The complaints that we get in are kind of, it might be a retail store, it might be a grocery store. And for example, you'll have somebody who went up to the store manager and say, I don't see people in here everybody wearing masks, your employees aren't. and maybe the store manager says, well, I'm not going to enforce that. Somebody else has to. So it's not like, I wouldn't call it a cluster of an industry that we're necessarily outside of the bars. We're just seeing one-off businesses and getting complaints about each of those individual businesses.
And are those very big though? You know, I went in Fresh Market the other day and everybody was wearing masks in there but 3 people. Can you really go violate a store manager if someone walks in? And yeah, I know they're doing their best, but there's always going to be people who aren't going to be compliant. And is that Fresh Market's fault? Then it really comes back to, you know, legally, can we make someone wear a mask? And you know, by the time you complain about the one individual who came in the store, they're probably already gone. So it looked like the mask problem was caused by bars, not the one-offs that you just mentioned. Because in general, I see people complying with everything that we've asked them to do around town. And it appears to everybody the protesters in the bars are what caused the big problem. And if we're not having that big problem at this point, should we do something lesser? It doesn't sound like the other counties that surround us are implementing some sort of martial law where they're sending police out, putting people in jail and things like that. From what I see around the community, it seems like people are generally compliant for what we've asked them to do.
Well, actually, where we're seeing issues is, as Dr. Pino said earlier, it's groups of people. So what did he call it? Is, you heard him just say it's mostly indoors, young people in groups, or you have, that's what happened at Memorial Day. Let's have 20 or 30 people get together at somebody's house, nobody's wearing a mask, and then all of a sudden you have 8 people test positive, and then they go out and spread it. So that's the concern, is these groups of people. Anywhere you have a group, and if they're indoors, it's even worse, and then they go out and spread. So that's why the holidays are really important. It's like, okay, do we learn our lesson with Memorial Day? Be very careful. We even had that with one of the agencies here in town. Groups of employees had a party, and a bunch of people tested positive and then brought it back to the office. So that's part of the problem too. And I don't know how you enforce something like that, where people are having parties at their own house.
I don't think legally you could, but the compliance, I mean, what we're talking about in this call is how do we go target businesses? From everything Dr. Pino is saying and everything you're saying, the problem is not Olive Garden, it's not Eddie V's, it's not Morton's, it's not all the people who are complying. It seems like, every day they're doing the right thing. It seems like it's the kids who get together on the lake chain, the kids who have a party at UCF, the group of people have a party at their house on a Sunday night. There's no way we can control that. I mean, we have to, that's why the whole point of doing the messaging that we are, but I mean, we got to be real with ourselves. I mean, we're talking about how do we, send correction officers out to businesses or code enforcement. And it doesn't sound like anybody's saying that's the problem. The problem is everybody's tired of being cooped up and they're gathering, and the disease is going more rampant, and we're hoping that we keep the curve flat in the hospitals until we have a vaccine. But I just, as we all talk about this, are we going to really go target these businesses that are in compliance? And anybody can come down Sand Lake Road or go down the whole area. Yeah, that's my area, but businesses are dead. I mean, they are dead. I just don't think that's where the problem is. It's the easy target for us to say, okay, let's go find them, let's do that. And you'll walk in them and say, wow, there is nobody here. This isn't the issue. It's the issue as you and Dr. Pino described.
If I may, I've again, this is just anecdotal, but just this weekend, I saw 2 examples of businesses that were following the rules for their customers, but not for themselves. A retail store being one, and then a convenience store being another, where most of the customers were wearing masks, but some of their employees were not. And you could see into the staff-only areas. And what was happening is that when staff were out with customers, they had their mask off. And then as soon as they were going back of house, if you will, the mask came off, which clearly is not in compliance with the rule either. And to some degree, I wonder if that's just a communication issue, to make sure that the businesses understand what these rules are, and that it applies not just to their interaction with customers, but also interaction with employees.
Let me just mention, I agree that we need to communicate better. Also, when we were called together, the bars had not closed, if I'm not mistaken. So now we're, we don't have the bar issue anymore because I was assuming that we were coming together to deal with that issue and businesses like that. I do see some indications, even car dealerships, that I don't see as much social distancing or a delineation of spaces and things like that could be communicated better. But from my vantage point, I agree with Mr. Woodall that I don't see how we can get into enforcement of face masks at this juncture.
This is Lorenzo. I would like to say something. I have 3 restaurants that I decided to close just for to carry outs last week. And the problem we were having is that customers, they want to comply with the mask, the social distancing. So I decided to close them because of that problem, because we're having a hard time of customers getting upset. And I just decided to, to go back to go. So it just is very hard for my managers and getting bad treatments, and it just is very hard they understand that we have to comply and go by the law, but it just is very hard. Is why I decided to go back to carryouts on the 3 locations. And if today customers will help us more to comply, we can get through this. Thank you.
Okay. We want to bring up, Lucas, a blank form. Yesterday we started down the path, and it's in line with what we're talking about right now, of making a recommendation of to the larger task force and then to the mayor.
Yeah, we'll share that with you now.
Okay.
And then everybody can take a look at it.
Yep, some sort of enforcement, and then, the county can look at the details of what they can't do and what that requires. I mean, I think that's outside of our scope.
Sure. Yeah, and as it relates to enforcement, I think maybe the best thing you could probably do is...
You also have consumer confidence, though.
I'm sorry? Go ahead, Roseanne. I defer to you.
I said, but the committee is also consumer confidence, and it looks like some of these things are to try and, as Chuck mentioned, the problem that we're having now is that with the numbers going up, most everybody knows somebody who's gotten tested positive, and people are scared, so they're not even going to establishments anymore. And so our businesses are really hurting. So that's the other part of this committee, is that consumer confidence. They go hand in hand. And this is what we all were afraid of. Your first meeting, you brought it up. People don't feel safe. They're not going to go out. And, so that's the other part of it. That's why we added consumer confidence to your name, your responsibilities.
Absolutely. So Lucas, I'm seeing the confidence building measures.
Is what you all talked about yesterday.
Yep.
As best as we could put together for you. So we can add to this, take away from this. If we'll scroll down to the very end, most of these are all more carrots. The last one on the last page here is a measured enforcement. And if this committee wanted to, after a predetermined period of time, cases don't go down and people aren't wearing their masks, to then provide or recommend that Orange County take the appropriate measures within the scope of their authority to start that enforcement phase. Kind of what Dylan was talking about. These are what other people are doing. We'd have to take a look at what we could actually do as it relates to enforcement and the mechanisms and the tools that we'd have at our disposal to get compliant. So if you all wanted to do that, the best probably way to do that is to make maybe a more blanket recommendation that we could determine. The Orange County staff can determine, the mayor, Roseanne, deputy chief of staff, and the county attorney's office can determine what that amount of period is, and then what to do after that period in terms of enforcement. So that's kind of what that last one is. Most everything else was all of your ideas on more carrots and sticks.
Can we keep it on the
We're happy to amend this in real time as you all discuss it. So
can we keep it on the? Can we keep it on the measured enforcement for a minute there? I want to focus on that right now, just so we can discuss it before we start running out of time or something. So can you scroll back down, please? Measured enforcement down at the very bottom. I'm not seeing it on my screen. There it is. Okay. So how does the team, everybody on this call, how do you guys feel about this language and what Lucas just said, given everything that we've been discussing? It includes businesses and citizens, and the county would have to define what they can't do and what that would look like.
Evelyn, I think what he's got as far as a blanket approach is probably the right direction right now. I mean, we all know that, or can assume that somewhere around July 11th or 12th, we're going to see another spike because of the 4th of July weekend. And we're probably going to have to wait till August 1st, on or about August 1st, to see what direction the county's going in, to see what we need to do. I think Jerry Deming's putting in the mask for everybody to wear right now. Hopefully we're going to see help from that, but it's going to, as we know, we're going to rebound again in a week. And really have Dr. Pino, if he can share with us how, what the cases are coming from. They talk to the people who get the cases. Is it from these groups of kids gathering? Is it from the parties? Or is it from the businesses? Because then we can focus on where the problem really is coming from. Because if it continues not to be from the businesses, we may be wasting time doing that and trying to get the message out or what we can do to stop the gatherings. But I know there's going to be a lot of 4th of July gatherings and we're going to see a result from them. So I think this language is reasonable right now because we just shut down the bars. We haven't seen the full extent of what that's going to do. We haven't seen the full extent of what the face masks are going to do. And maybe it should be a watch and see approach right now, but the thoughts are that we're going to revisit it depending on what happens over the next 4 weeks. That's my
This is Robert Ansueda with the Orange County Sheriff's Office. I think we have to be very, very careful on once we give it a certain amount of time and we start going into the enforcement phase of businesses and citizens on who's going to be doing it and how we're going to be doing it. And I think this needs to be a discussion probably with Mayor Demings and Sheriff Mina one-on-one to see how we're going to do that. Because in today's times, as we see the distaste for law enforcement across the nation, we just don't want to cause any more uproar than is necessary. So I think we need to be very, very careful moving forward on the enforcement side of this aspect.
Officer, I 100% agree with you today. I saw 5 officers at Ale House and thank them for their service and your service. And I agree. Whatever we do, and if we do anything with businesses and restaurants, I personally don't think it should be law enforcement. They've got enough to deal with on their plate right now, and I think we should figure out how to do it through Orange County code enforcement. The businesses always look to code enforcement anyhow. We look to the health department coming in restaurants. We look to the Department of Business and Professional Regulation. I just don't think it's right for us to put something else on their plate to make the community upset with them.
Hi, this is Stephen from the Mall at Millennia. And again, I'd like to echo Robert's comments as well. And I think that maybe even a little bit more of a conversation with this work group, if the mayor thinks we need to get into some sort of an enforcement phase, that perhaps we can go back or come back together as a group and discuss that further in more details before just sort of turning it over and not knowing exactly what that enforcement would look like.
I can tell you that when we do receive calls of businesses maybe not social distancing or to that effect, if we do receive a call, we will respond out, and usually we inform the business owner or some citizens, hey, you need to wear a face mask, and compliance is almost at 100%. Oh, okay, I forgot, or my bad. So we're not seeing any major issues at this time, and hopefully, knock on wood, we won't. And, with the compliance that, I went out today for lunch and saw 99% of the people I came in contact with were wearing masks, which was great. So hopefully with these mandates that our numbers are going to start to decrease.
And we also do notify the health department too, Dr. Pino and his team. If we get a number from the same location, they call. And when the Department of Health calls and stops by, that's a big call. When they walk on your site, and they'll go out and do a spot check too. And so we've been trying to do that's again, can we send somebody out to just educate them and say, hey, listen, we've gotten some calls about this. Can we come out and go over your safety protocols? And then also through their contact tracing, they are able to, and somebody mentioned, I think Chuck, you mentioned the break rooms. Those happen to be another area, you know, where people cluster together and they don't wear a mask. So a lot of it is the Department of Health is also doing some spot checking too, following up.
Okay. So it sounds like we've got a statement everybody agrees with. Do we want to take it up for a vote to make a recommendation? A motion to approve?
Did we look at the rest of it? I mean, it's all one. Are we looking
Well,
at
the rest of it is on the consumer confidence. I think, Lucas, is that correct? The rest, the top part is the consumer confidence and this part is the measured approach?
Yeah, all of those, the top parts are all carrots, and that last one is a generic stick.
Then I'll make a motion, Chuck Woodall.
Do I have a second?
Fred Kittinger, second.
Okay. Everybody in favor say.
I'd like to have a discussion on the motion, if that's okay. This is
Go
Stephen
ahead.
again from Mall. Again, I would ask that we insert something in that paragraph that if there gets to be a point of consideration for enforcement, that this working group come together again to discuss it, which I don't think is specifically mentioned in that paragraph.
And to add to what Steve said and what the office has said, that we would discuss it further and discuss how it could be done through existing departments other than the law enforcement department. So whether we did it through Department of Business and Professional Regulation or the Health Department or code enforcement. So maybe we amend it that we're going that direction so we can let the mayor know that we think it should be something other than police enforcement.
Okay.
So the question is the specific penalties at this point, and who would be responsible for enforcing them? As Dylan said, typically with these, we're up to $500 fine, 60 days in jail. So there are some kind of baked in kind of penalties already. I don't know if you want to amend this statement to say if cases do not increase before a certain time, this committee recommends to Orange County Mayor Demings to utilize his enforcement powers, and that would be done, of course, through the county attorney's office and finding the appropriate way to have this stick be carried out. We're happy to amend this if you all would like.
Maybe we make it more generic, go back and say that to Steve's point that the committee will reconvene, pick a date, July 18th, to see what the successes that we're having in our community. And if we are not having downward trends with the closures of the bars and implementing a face mask, then we'll reconvene to come up with additional measures to put in place at that time.
So after a period of time, if cases do not decrease, prior to maybe instituting penalties for businesses, the committee will reconvene? Oh, okay. I see you're writing something already.
Lucas, July 18th is a Saturday. So if you want to say by July 17th.
You have 41 people watching you type with this.
No pressure.
I'm talking as I'm typing here, sorry. So committee will reconvene, or I'll say working group will reconvene by July 17th, 2020 to reassess the number of cases and if voluntary compliance is making an impact. The assessment will include specific recommendations
On enforcement and,
or enforcement measures.
yeah.
Mitigation on enforcement.
And penalties.
Enforcement measures and penalties?
Yeah, if I remember the conversation.
Yeah, I think that'll work.
Lucas, I don't think this is quite what you want, though. You said the number of cases in voluntary compliance is making an impact. You mean it's not making an impact, or if people are not?
Like voluntary compliance is how maybe a positive impact probably is the way to qualify that.
Well, yeah, if it's making a positive impact, then we don't need to reassess.
We'll reassess whether it is. So we'll know by July 17th, have cases gone down or gone up. And if they continue to go up, that means over the course of the next 2-3 weeks, people aren't voluntarily wearing their masks as we ask them to do. And if we come back after 3 weeks and find that they're not doing that, then it would be your alls with the doctors, Dr. Pino Rawls and other doctors, to give you the data and the science from which to then make specific recommendations on what is the next step, because people aren't voluntarily complying.
Right, I agree with you on everything. It's just not worded. It just doesn't say that when you read it.
Sure. Okay. So help me, Chuck, or anybody. How would we?
Well, if you start off with the in front of committee, the working group will reconvene by July 17th, 2020.
Hold on. Yeah.
Working group will reconvene by July 17th, 2020 to reassess the number of cases. If voluntary compliance is making a positive impact.
Wait. So 2020 to reassess the number of cases, and then what?
And keep going. And voluntary compliance is making a positive impact.
Okay.
One moment, Chuck.
Yeah. There you go. Thank you. Is making a positive impact. The assessment would include.
Wait, hold on. Before you do that,
say,
Lucas,
go ahead.
if voluntary compliance is making a positive, remove the word "and." And after impact, then after the word impact, then we will remain the status quo. Then put in the event cases continue to rise, and non-compliance events, then the group will make and non-compliance events continue to occur. Then the working group will make an assessment, So the group will make an assessment which will include. So, which will include. I think that covers what we all talked about.
Comma before which.
And
you just want to make recommendation plural.
What about if you say assess options, then the working group will assess options and make recommendations on enforcement measures. Just say, we'll assess options and make recommendations on enforcement and penalties. On penalties and enforcement, penalties should go first. On penalties and enforcement.
My only, I like most of that. My only issue with it is the language about in the event cases continue to rise, because I don't want to limit ourselves if the cases remain even or, start to drop to a small degree. I don't want to limit us from not being able to consider enforcement. If it's not dropping to a satisfactory degree, I don't know if we need to set a level or whether it needs to be somewhat vague, but I'm just worried about tying it just to the continued increase in cases.
So irregardless of what takes place over the course of the next 3 weeks, this committee will reconvene, evaluate, and assess the situation, and then proceed accordingly. Is that what you're saying?
Yeah, Lucas, you're going to take off the first paragraph, though. You're going to start it with the working group, right? Or the first sentence, because it's all redundant now at that point. So if you started with the working group.
So just, remove the first sentence. And you're committing the working group.
We start with the working group.
Yeah. I think what Dan's hitting at is if you don't have a goal, just the status quo is not.
Yeah, but we're giving ourselves the option to look at that when we get back July 17th, because it's not the number of cases. We all know that. It's the positivity rate. And if the positivity rate is not trending down toward 10%, 12%, and it's starting to go up above 16 or 17%, then we know we have an issue, because we're going to get more cases. We know that for a fact. It's really the positivity rate that makes a difference at the end of the day.
What's your definition of the two words status quo, which means that we'll continue phased reopenings?
Well, I would say status quo means that we're all continuing to wear masks, as the mayor ordered. We're continuing restaurants at 50%. We're continuing to phase 2. I think that's the course we're at.
Status quo is hopefully that without a mandate and enforcement, people are voluntarily wearing their masks by then, and that is the new normal, the status quo. Okay.
It's all uncharted waters. I think the language we have just gives us all the ability to get back and talk about this again. You know, nobody knows where we're going to go. Obviously, if we start seeing big spikes, changes have to come down the pike.
So since we have changed the original language that we had a first and a second on, do we want to reissue the first and the second? Are you guys okay with your first and your second, and we continue to the general vote?
I think we
so would those who made the motion in the second be willing to accept a friendly amendment from Mr. Chuck to then have discussion and then vote on?
Well, Chuck had the first.
Yeah, so I accept the amendment.
Oh, Chuck, my bad. Sorry. So.
Well, that's also maybe part of the motion.
Yeah, if I may, I'm still just I'm just still a little concerned about the language about in the event cases continue to rise. I just don't want somebody on July 17th questioning if we, do decide to assess our options and make recommendations for somebody to come back and say, well, you can't do that. The cases didn't rise. They stayed the same. I'm just worried that limits us. Maybe it's just me. I don't know. It just seems to limit us a little bit to say that we will only assess options and make recommendations if cases go up.
What about if you said to reassess, the group will by July to reassess the COVID-19 health-related numbers and if voluntary compliance is making a positive impact? Because there's a lot of numbers in there, including hospitalizations and things like that. So I think if you just keep it COVID-19 health numbers, you're good.
Yeah, you're right, Roseanne, because we're going to be looking at positivity rate and all other factors.
Data,
and all those.
And and that way you can look at all of them.
We're going to know if we're running out of ICU beds and we're running out of hospital beds and we're up to 19%. We've got a problem, and it may be greater than just what we're talking about.
Yeah, I think what we could do at that point then is instead of saying, tying ourselves to if cases continue to rise or if non-compliance events continue to occur, we could just take that out and say the working group will assess options and may make recommendations on penalties and enforcement. I think that leaves it up to us then to decide whether we want to based on what those data are showing. Does that make sense?
Yeah, Dan, this is Kelly. Will you restate that?
I was just saying, now that we have, we're going to review the health numbers and related data. I don't know that we need the line in the event cases continue to rise and non-compliance events continue to occur. I think we can just say the working group will assess options. We're going to meet on July 17th. The working group will assess options and may make recommendations on penalties and enforcement. It kind of leaves it open for us to decide whether we want to do that or not, based on the data that we're seeing.
Yeah. Delete everything after if the number and up to working group, it sounds like.
Lucas, delete the then we will maintain the status quo.
Yeah. And then I would add the word may before make. So we're not saying that we definitely will make recommendations, we're just leaving it open that we may, based on the data that we're seeing.
And are we going to reconvene by July 17th or on July 17th?
By.
Well, by the way, that has no literate sense to that sentence whatsoever.
Yeah.
I mean, why don't you just take off everything if we're going to do that, then just say the working group will reconvene July 17th to reassess the COVID health numbers and related data, make determinations at that point in time. Because that it doesn't make sense. If we're doing well, we're going to assess people. So why don't you just take off everything after related data and say, the working group will reconvene July 17th to reassess the COVID-19 health numbers and related data and make determinations at that point in time on additional measures that may need to occur.
I mean, I know that like there's that at the bottom line, it says the working group will assess options and may make recommendations. So you may not. So you guys are kind of giving yourself some wiggle room with respect to the scope of what this working group is supposed to do. But I'm happy to, if there's a consensus to.
Well, but your sentence preceding says if the number of cases voluntary compliance, which doesn't make sense, is
That can be eliminated. That can probably be eliminated.
Yeah, I agree with that.
Voluntary compliance is making a positive impact. So delete from cases is to cases.
Yeah, so if you eliminate that,
start there.
That whole sentence to impact.
Yeah, you can delete the entire sentence, Lucas.
All the way to impact.
It's voluntary. Okay.
I think we're turning our strategy into a calendar appointment.
And then just add at the end of this, go ahead and delete that, then put the working group will assess options and may make recommendations on penalties and enforcement based on the current data. Just put based on the current data. So whatever the data is, we'll determine at that time.
Yeah, I think that makes sense, Chuck.
Okay, we sure beat the heck out of that.
We have an amendment to the amendment to the amendment. I'm just
And
kidding.
so Chuck, you're okay with the language for your motion?
I'm okay with the language.
Who had the second?
This is Fred Kittinger. I have the second, and I'm fine with it.
Okay. Lucas, did you hear that? We've got the first and the second. They're okay with the amendment to the amendment?
First for the minute and Fred for the second.
Yeah.
Any other discussion?
Okay. All in favor, say aye.
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 Any opposed, say nay. Okay. Motion passes. With that, Lucas, I think we can go back up to the carrots. So yesterday we talked about making it cool to wear a mask. One of the ways we can do that, obviously get some influencers in various different areas, including elected officials, celebrities. We've got the NBA and the MLS coming, so an opportunity there to explore that. And I think this is more for probably our marketing team to do some of that. The marketing team that presented yesterday also launched a social media campaign, and there was some research done on all the possible favorite channels, marketing channels. And you can see the list there. John DiArmas also mentioned leading by example, citizens wearing masks, catching people doing the right thing, catching businesses doing the right thing, and promoting it at a mayor's press conference. I think there was some discussion also possible a road show where we get some B-roll by going out to the business and catching them doing the right thing, and then promoting them on social media and other marketing channels. I think that's all pretty standard. Any questions so far? With the Yelp thing and catching people doing the right thing, we talked about businesses following the guidelines. One of the things that I was specifically thinking last night is, just like a wall of fame, do we want to list anybody that isn't complying and has had several complaints against them, kind of peer pressure type of thing? I don't know if we want to do that. The Yelp thing, you know, if you get 5 stars and now you've got 4, because
I think you may have a defamation issue if you do that, you can be sued through the county.
Okay. So we don't want to do anything like that. The Yelp thing, we take care of that.
Here, you know, one question. I'm just looking at the Orange County coronavirus page right now, and I'm wondering whether with the Yelp partnership right now, would we be able and willing to include a link to that on the county website?
A link to
Yelp, just either to that or just, you know, a link to the new campaign that you've launched, Becca and Lorene.
Actually, we were so focused on getting it up, we should make sure the county, we reached out to the county website folks to make sure that it's included as a resource there. So many people go there. You know, that's a good point.
Yeah, I think if people know that Yelp is a resource for them to go to, also, that'd be helpful.
Well, and Yelp helps us with non-compliance, right? Because if you went from 5 stars to 4 stars.
Right.
And Evelyn, to answer your question, I think if you all do decide to go down the route of enforcing or penalties, that will in essence become that kind of list, because people can go to that, you know, just like a food safety violations or something like that.
Absolutely.
So that's probably best on that step, because there's a natural point to that one. But yeah, I'll do Yelp and then just the campaign in general to get with the county team.
Yeah. Well, and I think the B-roll and the roadshow are going to be positive things. So I think, you know, we'll get more from that than going at the opposite direction. But does anybody else have any other ideas before we move on to individuals? Anything for businesses?
So yeah, I have something. Oh. Okay, I'll go. This is Jessica Hammer with Full Sail. At the top where you mentioned the influencers, yesterday we did mention college athletes. Do we want to list that at the top?
I think we should.
Yep, we'll add that. I'm sorry. Yeah, we'll add that right now.
Anybody else?
And
Hey,
just,
everyone, this is Carrie Burns from FRLA. I had a quick question. The marketing materials are so amazing looking, and I'm wondering, do we have, back to a point I heard earlier, what I'm seeing where I am is that businesses who have signage outside that say, you can't come in here without a face mask, basically. They say it in a more nice situation than that, but I wonder if we can also encourage people to be caught having that great signage outside of their businesses. I think that signage helps the business owners too, by letting people know before you come in here, these are the things we're asking you to do. The signage you guys have put together for that marketing campaign is amazing. So can we push it out more regularly, or how can we get more businesses to put those posters up to let people know you can't come in this business unless you're complying, which also helps the businesses to kind of take the onus off of them, because when people walk into a business and they refuse to wear a face mask, then it puts the owners or the operators in kind of a bad situation as kind of being the bad cop, if you will. So anyway, the point of that was, is there a way that we can get those posters out more aggressively so that we can help our businesses with policing the compliance?
Roseanne, in our initial talks, we had talked about once we got all the art online to do maybe some printed supplies. I'm not sure, I guess we need to work with the county of what distribution points there are maybe for if we wanted to print posters. I know one of the ideas the group brought up was like at the PPE distribution or something like that.
Well, we talked about, we're constantly giving out PPE. I mean, we've given over 6 million pieces of PPE out, masks out. And so for small businesses, so there we have a distribution channel in place that we could always just put some posters in with the PPE. You get a bag of PPE and we stick the poster in there because it's going to businesses. And then we're also, if somebody's coming in and getting tested, we could just put something in there, the guidelines in there, and then when firefighters are out and they could go on a call.
I would say that, like Carrie, who's an association, myself, who's an association, the chambers, we could also be distribution points. We can also share links so that they can fit them themselves. So there are various ways we can accomplish that, and then, get the footage of it posted out on their businesses. Okay.
Okay. Can I have just one suggestion on the make it cool to wear a mask? Maybe just on the phrasing on that. I wouldn't want it to get out where it looks like I don't know. I just fear it might backfire that kind of terminology with the younger set. Like if we're trying to make it cool, that maybe we just lighten it a bit to just say, I don't know, something that wouldn't off-put college kids if this happens to make it out, if it starts to get in the media or something like that. I think if you say you're trying to make it cool, then you're normally not. So maybe it's just reinforce the fashion of it, or reinforce
the benefits.
Make it fun. Well, yeah.
Fun.
Reinforce fun mask. Maybe reinforce fun mask campaigns. And it's the campaigns that are fun. I know it's just a technicality, but.
no, I mean, Becca, you're right. If you say you're cool, you're not.
Could you say that
yeah,
again?
As a mom, I can tell you if I say, hey, I'm going to make this cool, that's like the kiss of death, right?
Yeah.
So, Becca, could you say that again?
Yeah, maybe just like reinforce fun mask campaigns or create fun mask campaigns, something like that.
Well, see, that's the nice thing about this. You're marketing. The rest of us just get to write things on paper, very technical.
Yes.
To that point, and just since this is, I'm assuming, going to be a public document, just double check the spelling of some of the social media networks that you have listed below. Some of the ones that are listed as 2 words are actually 1 word, things like that. I would just double check those.
Mm-hmm.
I don't know that you need to do it on this call, but just,
No, we're fine to do it in real time. It's okay.
LinkedIn is 1 word, Snapchat is 1 word, WhatsApp is 1 word without the apostrophe, YouTube's 1 word. I think YouTube is 1 word. I can't even remember now.
It is. I think that's the spell check.
Yeah, it is. Yeah, spell check is always fun with these.
Another thing I had been thinking about as far as engaging the community and maybe getting more individual compliance is maybe engaging the help of communities and HOAs and those people that are out here in our communities telling us, how we should be behaving within our own communities, maybe getting the HOAs and them to help us promote, help us educate people to get compliance with large gatherings, with things happening within the community. I don't know how you guys feel about that, or if anybody's got any other ideas. Yes.
I think that works. I think we should also work with chambers of commerce in the county.
So the Chambers of Commerce all received the initial launch materials. We sent an email out. But what we can do and need to do is follow up with personal phone calls then to each one and work through, kind of like we did with the media this week, where we follow up with each one individually and ask them how they can help support. Do that.
And I don't want to stifle conversation, but we have
it's a great idea, and the county was they've been really great on getting information on Next Door Neighbor. They have a really active Next Door Neighbor account. So we can, I don't know, I don't work with that personally, but they might have some ideas there of how to reach those delays.
What if we can get Ring camera? I mean, they've been doing some cool stuff with Amazon deliveries and whatnot.
We've got 5 minutes left on this call.
And Carrie put in the chat, I think associations. I don't know if you got it in the notes.
Oh, okay. Chambers of Commerce.
Yeah, I just think we have a lot of great associations and membership organizations that would be willing to help too.
Fantastic.
And also the arts and culture groups.
Yes.
Churches? Pastor Zach?
Absolutely, absolutely.
Anybody have any other ideas?
Hi, my name is Danae Green. I'm with, I'm representing Full Sail. I had an idea for what you can title the mask campaign. You can call it Why I Wear My Mask. That way it can kind of be like an umbrella term. You can have people on social media showcasing their fashionable masks. It's catchy. It can be hashtag. Yeah, that was my idea.
Sounds good.
Sorry, say that one more time.
You can title it Why I Wear My Mask.
You know, that's a great point, and it really echoes something that someone had mentioned yesterday, and I think it was one of the student advisors too, that it's not, they don't wear it for themselves, they wear it for other people, like their parents. So I think that's something that we're hearing from the college audience, and it's a great great thing for us to keep in mind when we try to message with them.
It's positive.
And this is a living, breathing document, so we can continue to make edits as we move forward. We do just have a few minutes left on this specific working group, but we can schedule additional meetings. The mayor has a press conference coming up at 4:30, and so we're going to need to wrap this one up pretty soon. But I think these are great. We'll keep them in the hopper, and we'll coordinate with the chairs of this committee or working group, along with Kelly and Roseanne and Carol, the rest of the senior staff, to determine when our next meeting might be, so we can continue to kind of look at these. But I think what we've gathered from today is specifically one recommendation towards the end there that you've all voted on, and so we'll move that forward, and then continue to wordsmith with you at our next meetings these other recommendations. Does that sound fair? Is that okay?
Sounds good to me. I think we're at a good point.
Okay. All right. If we can wrap, then I'll leave that to our co-chairs.
Pastor Zach, I'll hand it off.
No, we're good to go. Thank you so much.
Okay, everybody, I think that means we're dismissed.
All right.
Thank you for your
Thank
time.
you, everybody.
Thank you.
All right.
Thank you. Have a safe 4th of July.
Yeah, you too.
Thanks.